Doctors of Reddit, what made you say how the duck is this person still alive? I was an EMT and got called to a self-inflicted gunshot wound to the head. The state I was in mandates that a medical professional is needed to declare someone as dead, even if it's obvious. When I get to the house, the cops are securing the shotgun he used and looking around for information on family or friends. I reach down to feel his carotid, neck, pulse to begin confirming DOA, death on arrival. As soon as my hand touches his skin, his arm snaps up, grabs my wrist, and he slurs I'm still alive. I nearly sheet myself, but managed to keep it together. He was alive when we delivered him to the hospital, but HIPAA kept me from knowing what happened long term. Edit, HIPAA. Not HIPAA. Not a doctor, but my former step-uncle used to work on towers, like cell phone towers. His harness broke and he fell. Landed straight on his back. Doctors said he was lucky to make it to the hospital alive and wouldn't live. 6 months later he's walking and talking again. He just has short-term memory issues and his speech is slowed down, but he can still function and be a dad. When I was at high school in the 90s, some kid took 24 pills of Dramamine, original formula, when you didn't need ID to buy them, because it gave you an LSD type high. Thankfully this guy's friend took him to the school nurse as soon as he told him what he did. The school nurse called the fire station, no 911 in the town at the time, for an ambulance, and their first question was, do you have a time of death? Not a doctor, but a cop responded to a call where a dude shot himself in the head. Doctors said he didn't have much of a chance. He survived. It's actually super common for head GSWs to survive. I really don't understand how, but I've had one and my friend that works in the hospital has had a few. Not a doctor, and work in the veterinary world of medicine rather than the human world of medicine. Anyway, thought this was kinda interesting. Dog gets hit by a car and by some miracle isn't injured. So the owners and dog go on with their lives for the next month or so, until the dog is due for his yearly exam and vaccines. Doctor enters the room, takes a look at the dog and is like, what happened? This dog has a big old ducking dent in half of the top of his skull. It's indented enough that the facial bones on that side of the face are somewhat misplaced and pushed out. But by some crazy stroke of luck the dog healed up just fine, and has no apparent lasting effects besides that dent and a bit of an issue with his ear, as the eardrum ruptured from the impact. One of the craziest things I've ever seen. No hate on the owners. Not sure how they didn't notice a dent in their dog's head for a month. But they don't seem to be bad people. Or bad owners. Just maybe not the most observant people. My wife is having some medical issues right now. After a recent blood test her iron level was 3. And her platelets were 90. I can't remember what they are supposed to be, but they were low enough she basically had water running through her veins. Not a doctor but a medical assistant. I was doing some shadowing in an ER and young woman was brought in that looked pale and completely devoid of any life. Her left leg was mangled and her right arm and hand were both broken. She also had multiple head wounds. Apparently she had run off the road and flipped her car into a large creek where she was trapped for almost an hour. When the ambulance got to her head was just barely above water and she was completely knocked out. She had already been to another hospital where they took out her appendix because it had burst due to the trauma from wreck. I believe she also had kidney trauma since her urine was bright red. Everyone was baffled at how she was alive. One of my friends got hit by a minibus. Was in a coma for 6 days. Fractured both her wrists and dislocated one arm. Fractured her pelvis and damaged her spinal discs. Her chances of survival were lower than 10%. She somehow survived and is perfectly fine 3 years later. Not a doctor but a friend of mine's brother was hit by a train in high school and walked it off like it was nothing. Granted it was his own fault, he was playing chicken with the train and jumped out of the way at the last second. Or tried to. The snowplow on the front of the locomotive hit his legs as he was jumping out of the way and it launched him into the woods beside the tracks. Walked away like it was nothing. Finally went to the hospital when the shock adrenaline wore off and it started to hurt. No broken bones somehow, but loads of bruising and internal bleeding. Not a doctor but an uncle fell from a 3rd floor after doing some stupid shit, and doctors were amazed as to how his bones didn't pierce his stomach since he fell on his feet. He fell from a 3rd floor and survived? Did his legs break? Christ. That's a goddamn miracle. I don't think his legs broke. He is still alive and in fact joined the army a few years after that, so if there was any damage it was not very lasting. A true miracle, as you said. Graduated from medical school a few weeks ago and haven't started residency, so all of my experiences come from medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery, who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage IV endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. Not a doctor. And this is not a human. Our pet bunny had been acting sluggish and was eating and drinking very little lately. We decided to take him to the vet, fearing gastrointestinal stasis. What we find is we'd been barking up the wrong tree on his condition. Turns out he was severely anemic. And by severely I mean his red count was less than 10% what it should be. That he was alive at all, much less conscious and moving around, was a miracle. Vet prescribed a megavitamin iron supplement, telling my wife and I if he survives the ride home. Well, he did. He made a full recovery and is gleefully bouncing around our living room right now. Honestly, most things would just drop dead with a red count that low. But this is one tough bun. The underlying cause, by the way, was a parasite, which was also treated. Not a doctor. Obligatory. My friend's dad went skydiving and his parachute didn't open all the way. Hit a slanted metal roof at full speed. Broke just about everything possible but survived. And made a full recovery. I think the only thing that saved him from dying was the fact that the parachute deployed but didn't open. So it still slowed down his fall. But not enough to save him from injury. Not a doctor but in training learned about a Navy SEAL in Vietnam who sustained something like 75 gunshot wounds in one sitting while carrying every other member of his team, all of whom were incapacitated by gunshot wounds, to hell one at a time. And lived. Apparently his doc said his abdominal cavity was shot up beyond recognition hamburger and had no idea how or why he lived. Also supposedly one cop got shot one time in the arm in the Hollywood bank robbery back in the 90s, which were wild as duck in California. Told his dispatcher he was going to die. Then proceeded to do just that. Apparently mentality is everything. A guy came into the ER after episode of cardiac arrest, in which the girlfriend performed CPR on him and kept him alive for about half an hour before emergency services took over. Myself. I'm 18 years old and had 5 severe accidents in the past 6 years, 2 on my motorcycle, 2 while skiing, and 1 on my bicycle, and I've been flown to hospital in a helicopter 3 times. Somehow I managed to never break a bone except for my skull. Not a doctor but I have a classmate who had stage IV cancer in his lungs. The doctor said to his parents not to buy milk for him, because he will be dead when before it expires. He is still alive and well 10 years later. And he's cancer free. He lived his childhood in the hospital, but other than that, he is okay and is very healthy. So glad that we didn't lose a person like him. Artie here. Had a patient in the ICU involved in a bad car accident. This guy come in with a broken everything, multiple chest tubes and a torn right atrium. We were in the room a good 2 hours trying to stabilize this guy. Blood everywhere. Soaked through the bed. I come back a few says later and the guy is extubated. Sitting up in bed. Talking. I thought for sure this guy was gonna die. No way about it. Our attending comes by and tells this kid in this 30 years he's never seen anyone survive a ruptured atrium. I wonder what came of him and hope he cleaned his life up. Reason for the accident was his baby mama found out about his side piece and whipped the steering wheel while they were driving, causing the car to flip. Both high of course. Not a doctor. But after I had my second baby, the midwife came back in to debrief me. When baby was in the birth canal, his heart rate went really low. When his head was out, the midwife saw the cord around his neck and a literal ducking knot tied in the cord across the back of his neck. Midwife panicked and pulled the shoulders out immediately, which tore me and ouch because natural birth. Baby came out screaming and healthy to her great relief, because she had recently delivered a stillborn with the exact same cord issue. I could see it in her eyes that she thought baby was going to be dead and counted it as a miracle that he made it. Not a doctor at all, but knew this kid in my high school who said he cracked his skull 8 separate times doing dumb shit as a kid. Didn't even care or think about how stupid he was. I wonder if he's still alive today. Not a doctor here, but the son of a doctor. A middle-aged fellow had come in to see my mom because he had been noticing some weird discoloration of his skin. He removed his shirt and she saw what she described to me as the worst melanoma she had ever seen in her 20 years of practice. It made its way from his chest all the way around his back. I have no idea how he allowed it to get so severe. It may have been that he just didn't look in the mirror, or that he paid no attention to it before it started spreading. All I know is that he died shortly after. Lord only knows how that man got in his car and drove to the doctor's office with such advanced cancer, and how he never knew he had it until it was a week from killing him. Not a doctor, but the patient had severe meningitis and came into the hospital very far in. I was near death and such, but actually didn't take any damage from the meningitis. The doctors just said that if I came in like an hour later I'd be dead. Reading through these, I guess it's lucky I'm still alive. I had severe preeclampsia when I was pregnant with my daughter. I was induced at 32 weeks because I was too sick to continue the pregnancy. During labor, my blood pressure got to a high of 260/195. According to my medical records, I don't have any memory of this part of the labor. I spent most of the 12 hours vomiting and suffering with the worst migraine of my life. Compared to the migraine, the contractions actually felt nice. At some point, I guess I just blacked out. I've seen photos of me in the hospital bed, smiling and giving a thumbs up, but I have no recollection of those photos being taken. Anyway, eventually I was rushed to surgery for an emergency cesarean, and within a few hours of the baby being born, all my vitals were back to normal. I was recovering from surgery, but other than that, I was pretty good. Baby spent about a month in the NICU, but ultimately she was fine as well. She's currently sitting on the couch demanding that I get her a bowl of cherries, claiming she can't do it herself because she lost her legs and numb. She's 6. I'm a medical laboratory scientist, doing the lab tests that the doctor ordered. I was scheduled in blood bank, and my peep in hematology called for a heads up on a patient with low hemoglobin and hematocrit. I forgot what the hematocrit was, but the hemoglobin was 2.2, for reference. Indication for transfusion is a hemoglobin of less than 7 on a non-bleeding patient. I scrambled to get the blood typing, antibody screen and cross-match done because sure enough, the order for blood transfusion came. It's not even how the duck is this person still alive. It's how the duck did this person come in on time for a transfusion. Not a doctor, but my sister was struggling with an eating disorder for years. She would be in and out of hospitals constantly. One of her last visits she went in with a potassium level of 1. She's still on the wispy side, but she's still kicking. 24 YOIQ patient admitted unresponsive. Prior HIV diagnosis. He had been picking up his meds but not taking them for several months, so he had progressed into AIDS. All signs pointed to an infection of his nervous system that caused lots of brain and spinal cord damage. This was compounded by a rare clotting disorder completely unrelated to his AIDS that lead to dozens of small clots forming all over his brain. He was on a ventilator and not responding to any treatment for a week, showing many signs of brain death. A coup team with multiple docs and multiple neurologists that were cross-reading all our scans all agreed there was nothing to be done. After a long and tearful meeting with the family, put in a consult to organ donation and go home. Almost sheet a brick when I walk into his room the next day and he tells me how much better he feels and that he woke up in the middle of the night and pulled out his breathing tube because it was hurting his throat. Best guess is that the antibiotics and antifungals were treating the infection while plasmapheresis was addressing clotting issue. His labs weren't getting much better but apparently he was. Cancelled the organ donation consult. TLDR. So confident a seemingly brain-dead patient wouldn't make it that organ donation was brought in. But he woke up and extubated himself. Probably late, but my uncle discovered he was diabetic in the worst way possible. He had gone trick-or-treating and with him being in a wheelchair, people gave him extra candy. He ate all of it. Went into diabetic shock, unknown to my family exactly what it was. Shortly after, paramedics were called. They loaded him up and took him to the hospital. They tested blood sugar levels and said their equipment had to be malfunctioning. Get to the hospital and they test his BSL and said their equipment had to be malfunctioning. You see where this is going. 3 blood tests later and the hospital had to concluded that he had enough sugar in his blood to kill a baby elephant. He was in a coma for a week or 2. I don't know if it was medically induced or not, and he woke up mostly fine. After this incident he had to take insulin multiple times a day. I'm not sure if the episode exacerbated his diabetes and that's what caused him to need so much insulin or if he was just that diabetic beforehand. Not a doctor, but my roommate told me his IQ physician father operated on a garbage collector who fell into the truck as they were compressing the collected garbage. The other collectors managed to stop it in time. And he didn't die. He had broken most of his bones and he wasn't going to be walking for quite a while. But he was expected to make a full recovery. His father said that if he had been in there literally half a second longer, his ribs would have punctured his lungs, killing him. Lucky son of a Rick. Not doctor, patient. Walked into urgent care and told them I didn't feel right. They asked me for symptoms and I said there are none. After a bunch of eye rolling they proceed with exam. All of a sudden people are wide-eyed and running. My blood pressure was 279/168. It earned me a trip to the hospital in IQ. You know you are in trouble when you see panic in the eyes of nurses and doctors. Short on the exact details, but my dad is a family practice doctor in a teensy rural Northwood town in Wisconsin, and there's old Norwegian farmers who are stubbornly refusing to die or slow down. One of his favorite stories is a 90-plus-year-old who climbed into his hayloft and fell off but caught his leg in a rope on the way down. He hung upside down for several days before he was found and was fine except for dehydration. Went straight back to his farm after an IV. I also have a family member who hit a bear with his car and pulled over to check on it, move it out of the road, and another car came roaring around the corner, hit his car, and it burst into flames with his toddler child strapped into the car seat. He rushed back and managed to get the kid free somehow. He's 6 now, has pretty bad scars on his head, and when people ask he calmly says I hit a bear and caught on fire and my dad saved me.